Hi, everybody. We are back to take malnutrition one step forward. We're going to talk about malnutrition and progressing health issues that you might see in your elderly parents. I'm Pamela D Wilson. I am your host, your presenter for this course. Let's get started, as we always do, with the housekeeping slide. And you know how this goes. So I use the term elderly parent or parents for the person for whom you're caring. The outline for the module is in the course materials. Please do print the slide handouts. Follow along, fill in the blanks, fill in the dots. Stay with me. Let's talk about the objectives for malnutrition and progressing health issues. At the end of this part, you should be able to identify how malnutrition translates to increase medical care. You should be able to gain empathy for the health struggles of elderly parents and relate how being proactive can minimize or avoid progressing health issues. How malnutrition progresses. Let's talk some medical speak terms so that you can recognize terms used by the medical system and so that you can have productive conversations with doctors and other healthcare providers. By viewing nutrition from a medical perspective, it'll be easier to see the severe consequences posed by poor nutrition. The anorexia of aging, also called malnutrition, comes about from a loss of thirst and appetite and a decrease in the senses of taste and smell. As a result, the body loses muscle mass and body fat. These effects, combined with a slower metabolism and a higher need for nutrients and protein, results in weight loss. Weight loss and malnutrition result in a poor, weakened immune system that has a really hard time fighting off illnesses. One infection or illness results in the next, and a downward spiral of health issues continues to happen that makes it more difficult for elderly parents to stay at home where they want to be. Malnutrition is one of the aspects of the condition called failure to thrive that you will hear mentioned by healthcare practitioners. Let's talk about poorer outcomes. What then, when malnutrition is not identified, happens when it advances to a critical health concern for an elderly parent that ends them up in the hospital? As we talked before, 43% of elderly adults admitted to the hospital are malnutritioned. But not all elderly adults are hospitalized. This presents the risk of not noticing that an elderly parent is malnutritioned until severe health issues take over, and the situation is very threatening for the day-to-day abilities. If you remembered in one of the last parts, we went through all the signs of malnutrition. It's important to look for these on a regular basis. Malnutrition can result in a need for more and more frequent medical care. That includes, time to get your pens out, more extended hospitals and nursing home stays, two places your elderly parent does not want to go. Higher rates for readmission to the hospital for health conditions. Readmission is when your elderly parent goes to the hospital, they come home, 2 weeks, 3 weeks, 6 weeks later, where are they back at? They are back in the hospital. Your elderly parent has more frequent illnesses, maybe colds, urinary tract infections, and continued health complications. They have a more weakened immune system, which is this spiral of, I'm weak, I'm sick, I have another health condition, that gets solved, I stabilize, I get weak again, I have another health condition. Also, as we talk, skin wounds that don't heal, pressure ulcers that can become life-threatening and result in death, and more physical weakness that results in a higher likelihood of falls, hip fractures, other severe injuries from which your elderly parent will have a more difficult time recovering. Knowing all of this up front makes it easier to see that it's better to seek nutritional solutions before the body becomes weaker. Malnutrition can result in constant and ongoing medical issues that we don't want to have for elderly parents. It's better to have that consistent plan to manage and improve health conditions, to stop further declines before all of this just goes way too far. This involves coming full circle with chronic disease. Any chronic disease or illness, as we've seen, can decrease the appetite. Elderly parents then experience chronic pain, arthritis in the hands, back, and knees. That chronic pain makes it more difficult to complete activities of daily living, bathing, dressing, eating, transferring, toileting. And when an acute illness like the flu or respiratory infection, the coronavirus, that results in appetite declines. Aging and chronic disease are just this combination that can result in decreased appetite and poor nutrition if we don't do anything about it. It doesn't have to be this way if we know about the importance of nutrition early in life, in our 50s, our 60s, our 70s, and how all of this can affect us in our 80s, 90s, and even up to 100. Let's talk about some diseases that are associated with nutritional declines. We'll talk about neurological, breathing, and heart disease as examples, although there are many diseases that really are associated with nutritional declines. So people diagnosed with neurological diseases have an added risk of additional health complications. Medical conditions that are neurological include stroke, traumatic brain injury, Parkinson's disease, multiple sclerosis, ALS, that's Lou Gehrig's disease, myasthenia gravis, Alzheimer's disease, and dementia. Some neurological diseases include the complications of memory declines and difficulty chewing and swallowing. Difficulty swallowing refers to another medical speak term called dysphagia. A speech therapy evaluation can confirm difficulty chewing and swallowing. A barium swallow test may be required for a complete diagnosis. A special dysphagia diet may be recommended for persons with swallowing difficulties to avoid aspiration, that's breathing food and fluids into the lungs, that result in pneumonia. 16% of independently living older adults age 70 to 79 have dysphagia, but they may not be aware. That percentage climbs to 33%, almost 1 in 3 people, in people over age 80 and older. The consequences of dysphagia for the elderly, they're devastating. Dysphagia can result in aspiration pneumonia, dehydration, and malnutrition that results in death or other more severe complications. If you notice that your elderly parent clears his or her throat, kind of like repeatedly when they eat or drink, or they cough, or seem to be choking, make a doctor appointment. They may have early dysphagia, have their swallowing ability evaluated so that you can avoid another complication that involves nutrition and neurological issues. COPD is a breathing concern. Individuals with breathing concerns like COPD are more likely to have poor nutrition. A diagnosis of the COPD makes the body work harder to breathe. With COPD, the body burns more calories. A loss of appetite happens because of purposely decreased physical activity. You might wonder why, but activity with a person for COPD results in the need for oxygen and breathing. People who have COPD many times use oxygen tanks to breathe or to help breathe. People with COPD, then they reduce their activity because they want to minimize the body's need for oxygen and the stress that they feel from trying to breathe. It's kind of like never being able to catch up to breathe. They're always trying to breathe and they feel like they're struggling to breathe, and they're afraid of not being able to catch the breath. If you think of the energy that it takes you to walk up a flight of steps, think about that. While you walk up the steps, how far does it take you to become out of breath? And then by the time you reach the top step, are you out of breath or you're breathing hard? That feeling of being out of breath is how a person with COPD can feel all the time. COPD feels like you've got a heavy weight sitting on your chest, and it makes it difficult to breathe or to catch your breath. So take that breathless feeling that you feel from climbing a flight of steps and multiply it 10 times to imagine what it's like for a person with COPD to walk a flight of steps. When a person struggles to breathe, the idea of having to do any type of physical activity, it's scary, even though physical activity is one solution to better health. So this example just gives us more empathy for people who have any type of breathing issue, whether it's bronchitis or asthma or COPD. It's a very scary feeling. Let's talk a little bit more about heart disease, diabetes, and other conditions. Aspects of heart disease also result in nutritional declines. For example, congestive heart failure results in the body retaining fluid. People with congestive heart failure are usually directed by their physicians to monitor salt in the diet and fluid intake closely, because that fluid pools around the heart and makes it more difficult to breathe. Many chronic diseases like diabetes and others have nutritional components. The idea of being proactive is reinforced through the process of relating nutrition to chronic diseases to reduce the potential of other more severe chronic health issues. When the identification of chronic disease and its relation to poor nutrition is understood, elderly parents and their caregivers bear the responsibility to seek more education to manage how these chronic diseases will progress. As we discussed, actions to manage nutrition, they vary by disease diagnosis and the health condition of each individual. For example, for people with neurological conditions, efforts may be starting that special diet to manage difficulties with chewing and swallowing. There are so many issues to look at when we look at chronic disease and health. And I want issues with people who have dementia and chewing and swallowing and all of these neurological concerns. So many of my clients who had Alzheimer's or dementia eventually had problems with chewing or swallowing, and it was noticed by that by that little clearing of the throat that indicated that when they took a drink like this, it would either go down difficult or it would be like kind of stuck in their throat. The swallowing examinations and having physical and occupational therapy, especially occupational therapy for swallowing issues, can improve a lot of the swallowing and the choking issues. They may not totally go away, but it is definitely worth investigating. There are a lot of treatments for choking and swallowing issues. Make sure that you talk to your doctor, ask for a physical therapy and an occupational therapy evaluation. If you see a specialist, talk to them. There are so many solutions because nutritional concerns do progress depending on the chronic disease that they are associated with. You want to get ahead of the curve rather than being behind the curve and catching a lot of these diseases, because our goal really is to make health better for elderly parents and to become more educated about how to avoid many of these diseases. I'm Pamela D Wilson. Thank you for joining me for this webinar. I will see you in another webinar as we continue to talk about nutrition, health, and well-being.